Good afternoon, everyone. Thank you so much for joining us here at SAMHSA's Gain Center. Today, we are excited to present a webinar, Best Practices for Drug Courts, Implementing Effective Programming for People with Methamphetamine Use Disorder. And we are really happy to have two guest speakers with us today, Dr. Listwan Johnson and Janine Gonzalez. I am Melissa Stein, a Senior Research Associate at Policy Research Associates and the lead for communications out of the SAMHSA's Gain Center. And I have just a few housekeeping remarks. First, the views, opinions, and content expressed in this presentation and discussion do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Center for Substance Abuse Treatment, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. Throughout the webinar, we welcome you to submit questions. As you look at the right side of your screen, you should see a Q&A pod. You can click on that to expand it and enter in as many questions as needed. However, we won't respond to questions until the conclusion of the last presentation. Throughout the webinar, you'll see some polls pop up. You should have just seen a poll pop up on your screen, and we really appreciate your participation in these polls. The webinar is being recorded, and we will disseminate slides in the days following the webinar. We also will let you know when the recording of this webinar is posted to SAMHSA's YouTube channel. At the end of the webinar, we'll provide a certificate of attendance for personal use. We are not able to offer CEU credits for this event. Just a quick look at our agenda. We have some opening remarks by John Berg, a Senior Public Health Advisor at the Center for Substance Abuse Treatment. We have presentations by Dr. Shelley Johnson and Janine Gonzalez. And then we'll have some time for questions and answers at the end of the presentations. But first, I want to turn it over to John Berg for some opening remarks. John?
Thank you, Dr. Stein. Welcome, everyone, to today's webinar, Best Practices for Drug Courts, Implementing Effective Programming for People with Methamphetamine Drug Use Disorder. We appreciate you taking time today to participate in today's informative webinar. Stimulant misuse is emerging as a pressing public health problem, overtaking concerns about opioid misuse in some parts of the country. According to the CDC, the number of fatal overdoses involving meth more than tripled between 2011 and 2016. Use was reported to be also on the rise between 2016 and 2018 for most age groups. Results from SAMHSA's 2018 National Survey on Drug Use and Health revealed that methamphetamine use has significantly increased among adults ages 26 years and older in the United States, with a 43% increase over the previous year. With a number of jurisdictions experiencing an increased prevalence of methamphetamine use, some drug courts are very interested in implementing treatment and supervision approaches that are responsive to the specific needs of people with methamphetamine use disorder and polysubstance use with methamphetamines and other drugs. With the significance of methamphetamine use in the United States increasing and the complexities of providing effective treatment, SAMHSA has focused on providing resources to assist the field. Participants have been encouraged to watch the Great Lakes and Northwest Addiction Technology Transfer Center Network's three-part webinar series on stimulant use disorder. This is a great resource, and if you weren't able to view it prior to this webinar, you may want to visit it at a later date. This webinar builds from that series and focuses on issues related to specifically to the delivery of methamphetamine and stimulant drug use treatment when working with the criminal justice involved population. Our presenters will discuss best practices for creating and implementing drug court programming for people using methamphetamines and stimulant drugs, and provide key information that drug court professionals need to know when considering which evidence-based practices are the best fit for their program. In addition to drug courts, these evidence-based practices can easily translate to other criminal justice programs, such as reentry, pretrial, and other criminal justice populations. We are pleased to have two great presenters today, Dr. Shelley Johnson and Janine Gonzalez. I want to thank them for sharing their expertise with us today. I would also like to thank the Gain Center and their staff for their work in developing and facilitating today's webinar. And at this time, I'd like to turn it back to Dr. Stein.
Thank you, John. And now I'd just like to briefly introduce our presenters for today. Which Dr. Johnson is a professor of criminal justice and criminology at the University of North Carolina at Charlotte, teaching both graduate and undergraduate classes on the topics of criminological theory, institutional corrections, community corrections, and treatment and rehabilitation. She has served as a consultant to local, state, and federal agencies on the topic of assessment, treatment, and quality assurance within both institutional and community-based programs. Janine Gonzalez is the program manager for Mecklenburg County STEP program, that is Supervision, Treatment, Education, and Prevention. Through that program, she oversees operation of 6 recovery courts that focus on treating mental health and substance use disorders related to justice involvement. She is the co-chair of the Mecklenburg County Substance Use Disorder Task Force, and she is a certified criminal justice addiction professional and a certified court administrator. And we also want to thank you all for joining us on the poll. And just a quick look at our results, we see that there is a good number of you joining us from rural locations, but we're also seeing some of you joining us from urban and suburban locations. And we're seeing, as expected, a good number of people joining us from the judiciary, but also we're seeing some participants calling in from probation and parole offices, government, and community-based service providers. So we really appreciate all of you joining us today. And now I'm going to turn it over to Dr. Johnson to kick us off. Dr. Johnson.
Hello. All right. Thank you, Melissa. So I'm thrilled to be here today with everyone. Thank you so much for joining in to hear about this, I think, really important topic as well. As you'll note, the name is a little confusing here, so I apologize. I'm in the process of changing my name, which is why I'm listed a couple of different ways, but I'll be using Shelley Johnson moving forward. However, much of my published work is still kind of under Johnson Listwan. So for my portion of this presentation, I hope that we can kind of dive into some of the research without going too overboard on the numbers and facts and research. I don't want to bore anybody, right? But it's my sincere hope that you can leave this webinar with some tips, some ideas that you can find useful for your agencies when working with this population. So as the title suggests, the presentation is really about using effective strategies for people with methamphetamine use disorder. So we know meth use affects a number of people. Our latest statistics, provided by this National Survey on Drug Use and Health, found over 1 million people reported methamphetamine use, right? And so we know this is a big deal. Methamphetamine use has been called an epidemic, very similar to what we've seen other epidemics with crack cocaine and currently with opioids. There are some that argue that opioids receive unfair amounts of attention right now, given the severity of methamphetamine use in more rural and western states. And so we know it's important. But we're not going to spend too much time kind of getting into the details of what's more important and all of that, because we really, I think, need to kind of ask our basic question, which is, does the type of drug that someone uses really supersede other factors when we start kind of thinking about best practices? So as Melissa mentioned, I'm currently a professor at UNC Charlotte, but I've also worked in both the Midwest and the West, kind of involved with examining like the effectiveness of drug courts in both the state of Idaho, Idaho and Ohio. So as we know, methamphetamine use is higher in rural areas, western. So my Idaho group, right, they were a much larger portion of people in their sample reported methamphetamine use as their primary drug of choice. In contrast, Ohio, a larger portion indicated crack cocaine was their primary drug of choice. So we kind of set out to examine whether drug of choice mattered, right? So we hypothesized that these quote unquote epidemic drugs would be predictive of outcomes, meaning, those whose primary drug of choice was meth or crack cocaine would have worse outcomes when compared to the other group, which in this example with both Ohio and Idaho, the other kind of most common primary drug of use was either marijuana or alcohol. And so guess what we found? Well, we found drug of choice actually did not influence outcomes. So meaning the success rate was similar regardless of drug of choice. And by success, again, I mean outcomes such as arrest for a drug-related charge, program completion. We did not look at outcomes such as health outcomes or emergency room visits. There may be some differences there, of course. But I think this calls into question our need to design completely different strategies for people based on their drug of choice. So instead, we really need to be relying on kind of the what works literature or best practice literature when intervening with these populations. So if we think about we start to think about what doesn't work, right? Let's kind of start there. And so there's a large body of evidence that finds that sanctions alone do not work to change behavior. We know this, yet our criminal justice system continues to spend a tremendous amount of time, effort, money on designing punitive strategies, right? Increased surveillance, electronic monitoring, custody decisions, and so on. And it's not to say that consequences don't have a role when trying to change behavior, but we do know there's no consistent evidence that sanctions alone will have this impact. So what does work? As you can see here on the slide, we do have guiding principles of what does work. Many of you may have heard of the risk-need responsivity model by now. It's been around for quite a bit of time. R&R for short. Sometimes these are referred to as the principles of effective intervention, what works, best practices. These are really the terms we typically kind of throw around now when we talk about treatment services. But I want to take just a minute to kind of pause and talk about each one of these. First, I'd like to point out, though, that the webinar is really going to focus on this third column, which is kind of the darker blue, which is responsivity. So today we're going to focus a little bit more on strategies, practices that we can use to change behavior. But before we get there, I want to just spend a little tiny bit of time talking about all four pillars. So in the first column, we talk about, and illustrated there is the risk principle, right? So we look at whether or not we're treating the right population. And that's kind of the who, so to speak. And so are we actually focusing our resources where they should be by intervening with the most appropriate population? I mean, all of you know out there better than I, right, that we do not have an infinite amount of resources available to treat individuals in the community or in the institutions. And so we have a very finite amount of resources. And so we need to really focus those on those that we can have the biggest impact with, and that's the higher risk and higher need. Now, drug courts have done a great job with this. Just recently, but a couple years ago, I guess now, there's put standards out, and one of those standards indicated that drug courts should focus on the highest risk and need individuals. And this makes sense if we consider how intensive drug courts are, right? I mean, there aren't very many other types of interventions that last as long as drug courts, unless you're talking about maybe residential treatment or certainly prison. But most treatment, if we talk about 90 days or some of the outpatient, drug courts are fairly intensive. And so they have and are well designed to treat the higher risk population. But it's not only drug courts that should and can be treating that. So what we get into with the need is important as well. So if we talk about this need principle, which is that next column, so many of you out there listening probably have heard of the term criminogenic needs, right? The word criminogenic refers to kind of this crime-producing or crime-related factors, the genesis of crime, so to speak. But these criminogenic needs are factors we know basically have an impact on whether someone is at an increased likelihood of committing crime. And so substance abuse, right, or substance use disorder is one of them. We know individuals under substance use or under the influence of alcohol and drugs can get themselves in all kinds of trouble, right? Fighting, stealing, and making other kind of poor choices. But there are other important criminogenic needs too, right? And so if we think about, like, for example, peers, the people that you hang around with can have huge impact on behavior. And so another one, a criminogenic need is attitudes. Attitudes are things like thoughts, right? The way we think, our cognitions, our decision-making. And then, of course, we have things like impulsivity or family factors, whether they're employed or educated and so on, right? And so if you have an individual with many criminogenic needs, in addition to substance use, right, but many of these other ones, then they're higher risk for criminal behavior. So if we just kind of take that for a moment and we think about substance use being one important criminogenic need, but not the only one, right, because we know that substance use bleeds into these other areas, the peers, the attitudes, the lack of employment, and so on. So it's important to recognize that it's not enough just to kind of be real myopic or real too focused on just the drugs without considering these other issues, right? So when we develop our treatment plans for the person, we need to look at all the criminogenic needs and how they interact together if we expect to have, big impact on their behavior, right? Okay, so the third column then is responsivity. So responsivity kind of has two approaches. One is referred to as general responsivity. That's what we're going to go into today, which gets more into the cognitive behavioral approaches and the different strategies there. But before we go there, the other section kind of area is specific responsivity. These are the barriers. So specific responsivity is really kind of matching services to individuals based on their likelihood of criminal behavior, but also on the things that can get in the way. So motivation, is someone ready for treatment? Transportation, to get to the actual agency to attend. Childcare, literacy level, right? To be able to do the worksheet, if that's what's required of the curriculum. These are the barriers, right? So they're not necessarily the correlates, right? The factors related to criminal behavior, but if we don't address them, they're going to influence and impact the effectiveness of treatment. Okay, and so before we move on from this slide, there's the fourth pillar of these principles, and that's fidelity. So the idea is that we could be doing all these other things right? We could be serving the right population, we could be targeting the appropriate criminogenic needs, we could be using the best curriculum out there, and if we don't do it well, right, if we're not evaluating those services and monitoring those services and doing what we should be doing, then it falls apart. And so that's really a cornerstone of this model as well. Okay, so moving on from this. Today, like I said, we're going to really focus in on this general responsivity principle. So it's important to note this topic of best practices, R&R, this could be a multi-day training, much less the 30 minutes that I'm going to talk to you. And so we're kind of just focusing in and really tunneling and drilling down onto a particular issue for this webinar to make it a bit more useful. I want it to be a little more skill-based for you and something you can take back for your agency to make sure that you follow these kinds of best practice models. So as I mentioned, general responsivity, kind of focuses on this idea of cognitive behavioral interventions and practices, which we know are effective. There are a lot of these interventions that are out there that use these practices. Kind of as a side note, there's University of Cincinnati. They have their Corrections Institute. They've developed several great curricula. Thinking for a Change by NIC is another great one. Lots of examples out there. But most of the cog behavioral curricula use these kind of techniques or practices that we're going to talk about. So let's go with the first one real quick. So cognitive restructuring, right? So focusing on decision making. It's that script that's playing in our head, those micro decisions we make throughout the day as well as our big decisions. Our goal is to try to get people to slow down, kind of think through a high-risk situation. So let me use an example. So if we said, let's say maybe I received a call from a friend inviting me to a party, right? And they say, hey, come on, everybody's going to be there, let's go, and I'm trying to stay sober. I'm in the drug court at this point in time. So do I want to go to the party? Maybe I do, right? And the reasons I want to go is it might feel good and I want to hang out with my friends and I'm sick of being in treatment, but what are the consequences of that? Well, I'm going to fail a drug test. I might get kicked out of drug court. And so if we can get them to make that kind of stop and think, right, is what we call it, right, is to stop and kind of think of those consequences, slow them down long enough to come up with, okay, what would you think differently about the situation to try to get yourself out of it? So instead of thinking to myself, I said, oh, I'm sick of being in treatment. I've been doing this for so long. I could replace that with, you know what, I've worked really hard. I've been doing this for a long time, and I don't want to throw it all away. So on one hand, if I think I'm sick of this, I don't want to do this anymore, versus I've been doing this a long time, and I need to stick with it, that's going to lead to two very different outcomes, right? That's cog restructuring. Okay. So other skills that we would like them to have are things like, avoiding trouble with others, or problem-solving skills, or, emotional regulation skills, so that if I'm, in a situation where my boss yelled at me at work and I'm stressed out and I want to go take a drink, how do I get myself to calm down and get out of that? Okay. So those are the kind of skill development areas. But today we're going to focus on shaping behavior through rewards and consequences. And this is really kind of the idea of a behavior management system. So these typically exist in drug courts, therapeutic communities, juvenile institutions often have these as well. These are systems that, in place, if they're done right, use both rewards and consequences and can be really impactful at change in behavior. So a couple things to know, because when we look at behavior management systems historically, there was a movement in the 1970s, particularly in the area of therapeutic communities, where it got a little bit too focused on behavior management as a tool for shaming and for kind of almost a gotcha scenario, right? Where you had individuals, and this worked often in the prison environment, where if someone screwed up, so to speak, or broke a rule or infraction, they would do what's referred to as a pull-up, and so it was, oh, I caught you smoking in this area, or I caught you doing this wrong, or you didn't do that right. And a lot of it was just, really intensely focused on what was happening that was the wrong, versus doing things and focusing on things that really is focused on the right, which is the reward. So this is all founded by B.F. Skinner in the 30s. Don't worry, I won't go there. But operant conditioning, has really stood the test of time. And so we use it everywhere. I mean, not only classrooms to get kids to settle down, sit down, do your work. But I mean, Starbucks uses this approach when they send us our stars every time we buy something, or get us to do their stupid star challenges. Or, I got an email the other day saying, download the app and get free French fries from McDonald's, And they know that rewarded behavior is more likely to be repeated, So we love rewards. Everyone loves rewards. Great. But these kinds of successful operant conditioning models also need to be very goal-oriented, There needs to be a target behavior that we're looking to change. So in Starbucks, they're looking to get you to buy more coffee, or a McDonald's, or whatever the case may be. In a drug court model, you might use rewards to get someone to comply with a particular requirement of drug court, showing up for probation, showing up for a status review hearing. So if a person shows up for the status review hearing, the judge might praise the person, give them a candy bar, or a slip of paper to put into the prize bowl, whatever it may be. But it's also important to kind of look not at those short-term goals of just the showing up, that's important, but also the long-term goals, reducing recidivism, increasing sobriety, improving health outcomes. So the behavior management systems that are really effective tend to focus on the long-term stuff. And so let's say, as an example, I'll go back to a drug court judge, and you have that judge saying, nice job on a particular behavior. Let's say the person got a job. And so they're going to, praise them and say, I'm really glad I see you finally found a job. Well, we know it's not enough for them to just say, all right, attaboy, good job, and then move on, No, those judges typically kind of dig a little deeper and say, I know you've been struggling to find this job, balancing taking care of your son, trying to find a schedule that works, but I'm really proud of you that you went ahead and found this job at the, local car wash. I really hope that helps you, pay off your fines and fees, So now you're tying that reward, that praise, to a very specific behavior with a specific kind of goal in mind. And so that's what we're looking for, is with these systems, every time it's an opportunity to teach a new skill. Every time we want to be able to have them understand the why behind why they're getting rewarded. Okay, so when we think about kind of developing and implementing these behavior management systems, there's kind of 4 critical considerations, So first, what to do kind of when we're developing the behavior management system. The second is what types of rewards, consequences we should use. Third is the importance of kind of how we administer them. That's a big importance. And then the fourth is the importance of staff. We, of course, can't ignore the staff because they're doing the work. Okay, so first we're going to talk about developing the system. So you got to first determine why you're developing the system to begin with. I know it kind of sounds silly, but what's the behaviors you're looking to either increase or decrease? I mean, the behavior, again, I keep referring to it as the target behavior. And so let's go through some examples. So if you think in corrections or in general in treatment, there's many behaviors that we might target. Let's say, for example, a residential treatment program, So they might be concerned with how well the unit is managed. So they're going to choose a target behavior such as completing chores or attending to hygiene. However, I mean, if in order to change behavior long-term, we also want to focus on criminogenic needs. So we should be looking at like attendance in group, controlling one's anger when confronted with frustration, increasing communication skills, right? Now we're talking about something that's a little bit more tangible that they should be working on rather than just kind of the big ticket items. All right, so first recommendation is you develop clear guidelines. That kind of goes back to the target behaviors. How are we trying to do it in the setting in which we're working? In that context, the behavior management system really needs a detailed program manual. I mean, I work with agencies across the country, and one of the commonalities I see is high staff turnover. Not everybody, but it is the nature of the business that there is staff turnover in many correctional agencies. And so we want to make sure that we can train new staff on the system and everyone involved understands how it works. If the person who came up with the system basically has it all in their head and then they quit one day, right, does all that knowledge then go with them? It shouldn't, right? We need to make sure that we write that down and have something fairly descriptive. It's also important that we get the client's input, right? And so we often ignore the voice of the people we're serving. And I like to think it's not intentional. I believe that it's not done with malintent to say we don't care, but rather we tend to, as a system, get so caught up in our own meetings and our handbooks. And, we forget sometimes that we need to ask the people who are most influenced by our policies and practices. And so getting that client voice, getting that client input, what rewards do you want to see? What would you like to see happen here? And it's not giving them control over the system, right? We're not asking them to build the system themselves, but rather to get their buy-in to it, we need to have them say, you know what, candy doesn't motivate me, chips and soda does. Or, let's say you get people to give you gas cards as, an incentive, and then you give it to somebody who doesn't have a car. So it's like, well, what am I going to do with this, right? I don't have a car. Why do I need gas? And so those are the types of things, you want to be able to say, like, what motivates people? How am I going to make sure that they're buying into this? It's also really important to stay reward focused. We say, I have there on the slide, average of 4 to 1. Really, it can go up to even 8 to 1. And people hear that and they're like, what in the world? How am I going to be able to do that? And it might seem like a lot, but if you think on a day-to-day basis or even a week-by-week basis, you're not typically consequencing someone daily, right? Most people. But if you think about a reward, you could do daily, particularly if you're talking about praise, right? And so it's important to kind of think about, okay, praise is one of our rewards. We can do that a lot more than necessarily, I'm not suggesting you give somebody a gift card every day, right? Nobody can afford that, of course. And then the last thing just to kind of mention there too is the importance of kind of piloting the system. So if you do a new behavior management system, new set of consequences, rewards, try it out first, right? And if you're in an institution, that might mean doing it on a unit, a wing, a pod. If you're in a community-based group, you could do the Tuesday night group. You could do a small, just random portion of people. Try it out because there will be things you want to change, and then you can do that and roll it out to the larger one, right? Okay, so next kind of looking more at types of rewards and consequences. This is an area that Janine's going to get into next, which will be great in terms of what they've done with some of their rewards and consequences and their problem-solving courts. Obviously, I can't give you a list that's going to be inclusive of all the types of rewards and consequences out there, but we can kind of talk about some of the things we know can generally work. So if we think about the importance of having a range, so not just having one, praise being a big one, of course, I'll get to in a second, but having a range of rewards. And so if I had to kind of group them here, I'd put them in these 3 categories. So, and there's more, but stick with me. So we think about the different types. First is token rewards. So tokens can be symbolic items given to a person, right? So points. We give points to kids in a juvenile institution for doing their, chores, making their beds, so on and so forth, attending group, doing their homework. So once they earn a certain number of points, they can exchange it for something of value that's like maybe a food item or a toiletry or something. The second is a tangible reward. So these are material objects that can be given to a person in exchange, like food. They show up for the status review hearing, they get the candy bar. Those are important, but the social one, what's under that social category bullet point is verbal praise. So verbal praise is great because it's free, which is key. And it's also very effective because you can really tailor it into what the person did. And most of these other rewards, the token and tangible, should be paired with praise anyway, right? And so as I'm handing you the candy bar, it's not just handing it to you and walking away. It's telling you why I gave it to you and why, I'm happy to see you here and so on and so forth. And we could spend a lot of time on this in terms of, all the different types of rewards out there. Janine will give you some examples though too. But it's important to kind of continue to seek new options because they will get tired of the same old rewards over time. Okay, so next is kind of consequences. So I mentioned before you want a 4-to-1, right, up to 8-to-1 rewards to consequence ratio, but that doesn't mean no consequences, right? So consequences are part of the behavioral model, and it's very important. It's just the rewards are the preferred method for shaping behavior. We're just much more motivated to engage in behavior through rewards than punishment. There's a lot of people who believe that punishment should be the cornerstone, but the reality is that just doesn't kind of come to fruition when we talk about what changes behavior. So we're going to need a range of consequences, much like we have a range of rewards. And so verbal disapproval, much like praise, right, is sufficient. You don't have to jump all the way to putting someone in jail for the weekend because they missed a probation meeting, right? We need that kind of continuum of sanctions as we would expect. But it's also back to target behavior. So let's use an example. Let's say someone who's struggling to show up to probation meetings or to a group. So the target behavior, right, is showing up to meetings or group. So let's take the one of, group in a residential setting. The punishment might look like losing free time when they refuse to attend group. In the community, if they fail to report to probation, that might lead to a person receiving community service hours. So now we apply the sanction. So one, you kind of took away something positive. The other is you applied something kind of negative. It could go either way, right? What's really important is that once the target behavior is corrected, the person, starts showing up at the meetings or whatever the case may be, then we need to really focus on rewarding that behavior and telling the person we appreciate the change too, okay? Okay, so the next point really gets at what we discussed earlier with the principles of effective intervention, the R&R, but also the fidelity. Because remember, we said you could put all the R&R pieces together, but it could fail if it wasn't implemented correctly. So this administering the behavioral management system is really an important consideration. And Janine will talk a little bit about kind of the areas that they've had success in and perhaps struggled in when it comes to implementing these systems. So, but if I had to, focus on one thing when it comes to these behavior management systems that I think has a bigger impact than any other, it's whether or not the system is consistently applied, right? Consistency is a really key issue. Do we have a system or do we have an agency where all the staff are really on the same page, right? All the staff able to say, this is what we're doing, this is why we're doing it, this is why we're giving them points, this is why we're giving them tokens or praising them, or this is why we're getting, to this point. Is everybody on the same page? The problem we see, unfortunately, is that it really depends on the staff member. And so in a residential setting, that might look like staff on different shifts have a very different view of the behavioral management system. Second and third shift treats it differently than the first shift. Even in the community, even among, treatment providers, we typically see individuals who are just a little bit more rewarding than others who are less. We're never going to get 100%, right? We're of human behavior, but it's trying to make sure everybody's on the same page. And then the other, as we keep kind of coming back to, is going back to that appropriate target behaviors too, and really focusing on things like group attendance, completion of homework, participating in role plays, work performance, building positive peer associations. All of these need to be tied back to those criminogenic needs, right? And so when it comes time for a staff to decide, is this an opportunity I should take to reward someone for good behavior or consequence them? They understand what target behaviors they're looking for and can get really focused on that, right? And so, again, not the attaboy, but saying, I liked what you did because I know you're trying to improve your relationship with your mom. I like what you did because it's going to help you get that job in the future. It's an opportunity to teach, which gives them that crucial feedback. So every interaction is that opportunity to teach for them. And so, with our behavior management systems, we need to focus getting everybody, if you're in the prison, that means everybody from your security staff right all the way up to administrative level. If you're in the community, you're obviously talking about probation, parole, addition to treatment, judges. The drug court team does this, fairly well. But the whole system is geared towards long-term change. And so if we are, then it becomes even easier to kind of monitor for that drift, look for things that we might, need to change or tweak, or, again, staff turnover being a pretty big issue. Okay, so before we get to Janine, promise we're getting there. Talk about the fourth consideration, or the final area for mine, which is the importance of staff. So clearly, staff are key to this process, right? And so the staff characteristics, the relationship quality, all of that has actually been shown to be a very impactful of recidivism. And so that comes really with hiring appropriate staff, making sure that those staff members that you hire, of course, they have the credentials, the education you may require or the experience you may require, but it's important they have the relationship skills too. And so the qualities or for these relationship skills are things like warmth, being open, being genuine, having appropriate boundaries, having empathy, being pro-social, enthusiastic, why is it important for staff to be pro-social, enthusiastic? Well, of course, because they're the role models, right? And people are watching. In order to have the model, put in place well from the beginning, we have to train staff differently from the beginning. A sports analogy that several of us have been using for a little bit now is, the relationship, to explain this relationship, is the difference between a coach compared to a referee, right? So many people in criminal justice, such as judges, probation, security staff, we train them to take on more of a referee role rather than a coaching role. And what do referees do? Well, they enforce the rules, they apply penalties, they're the person who gives the warnings, the sanctions, they serve as the person who really kind of controls the event, right? They manage the event. But in contrast, what do coaches do? Coaches teach new skills, they reinforce, right? They know what needs to be improved. They're a role model in a lot of circumstances, right? And so the coach is the teacher and someone who is more likely to motivate a player than a referee. And so for many people out there, they remember good coaches, but they really only remember the bad referees, the ones that they thought treated them unfairly. And when people feel they're being treated unfairly, they don't typically comply. They typically, get into a stance of defiance in that way. And that's what we're trying to avoid, right, is those power struggles. So when we train our staff in corrections and we train them both rewards and consequences, can we train them to be coaches versus referees, right? Can that be one of our goals? I would argue it should be. Okay, so in summary, then, what we need to do is really rely on these principles of effective intervention, right? With the R&R model, focusing on our cog-behavioral interventions, doing a good job of setting clear guidelines, to adjust for that turnover that typically happens, and then having a system that has, this range of rewards and consequences that, again, can change over time and should change over time if need be, right? And so what I'd recommend for any agency is to have a person or a group of people or stakeholders, really just monitoring these behavior management systems over time, just keeping track of them. It doesn't have to be a minute-by-minute monitoring, right? We're so busy and we're so overwhelmed already with what we're doing, but doing a lot of spot checks, and if we move our system towards that kind of quality control model where we're all trying to improve in some way, we're better off, in the long run. And so that continuous training of staff and monitoring drift and kind of reorganizing ourselves every, 6 months, year, 18 months, depending on what you're working with, and how much change needs to be done, can be really effective. So I really appreciate you taking the time to listen to me for this last little bit. I'd like to go ahead now and turn this over to Janine so she can talk to you about her experiences in the field.
Thank you, Shelley. I'm honored to be able to just kind of share with you what Mecklenburg County Recovery Courts or drug courts have been able to implement when it comes to contingency management examples, as Shelley was mentioning during her presentation. In our Criminal Justice Services Department here in Mecklenburg County, we have pretrial, we have recovery courts, and then we have reentry services. So we have a little bit of everything that would offer the opportunity to use some sort of contingency management or behavior change. We have in our recovery courts the opportunity to work in 6 different areas. So we started our courts back in 1995, and we've grown to where we have these particular areas. And I show this distinction because what I really want to do is show that one of Shelley's points was to really know your audience. And that's important. There's unique characteristics to each one of these 6 courts. So we're trying to look for the best way to implement the contingency management protocols within each of these areas and be able to serve the individuals in the best way possible that's fair and consistent, but also recognizes the individuality. So our pre-plea court is just that. It's those who have been charged with a felony, but they don't have a past criminal history. And so they're given the opportunity to have their charges dismissed upon successful completion of the program. Our post-adjudication court are those who have those same felony charges, but have been convicted of prior criminal activity, and are then convicted of the charge that gets the referral into our recovery court or our drug court. We have those that have DWI charges, which in North Carolina is different than in other parts of the country, in that our DWI is seen as a traffic citation. And so we have those individuals whose licenses have been revoked, but really their criminal charge is nothing much more than a traffic citation. And so that has caused some concern about how we're able to deal with the needs of that particular court. Our wellness court are those who have a severe and persistent mental illness or a serious mental illness, and also have need of services within our court system to help them to manage their mental illness. So they don't necessarily need a substance use disorder diagnosis, but they are working in what is similar to a drug court or a recovery court. And our focus is really around providing stable connections to the community supports for them, assisting and getting them connected to medication management or housing. We have a high percentage of individuals in this court that are homeless. And so, therefore, the contingency management with this group is slightly different than it would be for the others. Our family dependency court, we call our FIRST program, and that serves families that have had their children removed from parental care and they're placed in DSS custody. And the primary reason for that is a substance use disorder. Obviously, juvenile delinquency is just that. It's juveniles, and we work with those that are 13 to 17 and have substance use disorder or mental illness and are involved in juvenile delinquency. So I have included an additional slide that gives you a link to the National Drug Court Resource Center, where, as Shelley mentioned, there's lots of different rewards and sanctions that can be offered. And the National Drug Court Resource Center.org site gives you extensive lists. They're not exhaustive, but they are definitely extensive. And so I wanted to make sure that that was an available resource for folks. So for us, in implementing our contingency management system, we really needed to look at the unique differences between our 6 courts. We needed to look at the unique differences of our team members. Those social workers that work in our dependency court are very different than the probation officers who work in our criminal court. And so really recognizing that has been important. Our community, we have buy-in from the community when it comes to being able to assist in providing some of our rewards, and just the opportunities that exist are sometimes things we never really thought of. And so really knowing where all of those pieces are has been important. Okay. There we go. What we have is a variety of rewards that we know work and don't work. So as what we've been able to look at, we've tried to make sure we have clear guidelines. We've a detailed program manual. We do all the things that Shelley was mentioning as part of her presentation in collecting data, scheduling training and orientation for new team members and ongoing training for those who are new so that they understand the process of what we're doing as well as the science behind it. We regularly schedule client surveys so that we get their input and make changes based on what the current group of participants in the program may see as important or not important. And we include questions as part of our exit interview to ensure that we're getting feedback from our clients as regularly as possible. When we first began our courts for about 10 or 15 years, we did what we thought was best practice. And we offered things like judicial praise and applause, certificates of recognition with regard to progress being made at treatment or in a phase movement from court. And once a month, we'd provide a small tangible reward, most likely a gift card, to those who were part of what we called our A-team. And on our A-team, we required 120 days of substance-free time, that they be compliant with meeting with their case manager, their probation officer, their treatment provider, random drug testing, and have a sponsor. All of those things went together, and we treated each of our 6 courts exactly the same. We found that using a fishbowl and different things kind of helped us spread those out as we grew, but we realized that it wasn't necessarily working in each of our courts. Our wellness court, as I said, has a higher percentage of homeless individuals. Those individuals, we have a spinning wheel. So you spin the wheel, you determine what your prize is. And the prize for that is dependent on, what you spin, but we change it up based on the season. So we have more winter items during the winter. We have a lot of food items. And we've even had clients in that court who were not really in favor of spinning the wheel when it was their turn and felt like it was something that we were going to, I'd give my spin to somebody else because I just don't want to do it. Until now, we're at a point after having implemented this in that particular court that they're asking the judge, well, do I get to spin the wheel today? So even the opportunity to spin the wheel is seen as a reward. It's seen as something that lets me know that I'm doing what I need to be doing and helps me in maintaining my own recovery. And that part has been very important in supporting the behavioral change and the compliance that we were looking for in that group. In our DWI court, most of those individuals are employed, so time awards are more important to them. They were not as interested in being able to get a gift card or spin a wheel, but what was very important to them was the opportunity to have their substance-free time acknowledged by the judge. So if something happened and the judge neglected to mention it right away for a particular individual, that was one of the first things that was mentioned. Judge, you didn't mention my substance-free days, and I want everybody to know that I've been able to do this and have this accrued this many substance-free days, and that's been very important. For our superior court clients, which are those that are convicted of felony charges and have most likely served a split sentence, those individuals at some point in time have the opportunity to be a judge for the day. And it isn't necessarily based on how long you've been in the program or how many substance-free days you have accrued. It's based on what's happened over the last couple of weeks. And so the judge giving them the opportunity to speak to their peers, to share what resolution they personally were able to come up with to a problem that's similar to what one of their peers is facing, has been seen as very rewarding for that group. And that's the one thing that most of them request is, Judge, can I speak to so-and-so? We give buys for court, which I understand are not necessarily best practice all the time, but it is something that's utilized on a case-by-case basis. And what we found is that when we give buys for court, most of the clients show up anyway because they want to support their peers. And so just that in and of itself, as having a peer come and be part of the court session to be there for me, gives me another reward that we hadn't actually anticipated. When it comes to some of our other courts in the juvenile system, our youth recovery court, we used to have a board that we would display, and it would show how many points somebody was accruing. Our clients really didn't like that. Our youth said, I don't want everybody knowing that I'm where I am on that chart. I just want to know where I am on that chart. So we stopped displaying it. And our rewards in that court are obviously geared to our youth, and so they're much more in line with being able to have a gift card to a fast food restaurant, a movie pass, something along that line. We also implemented with that one the opportunity to have lunch with your case manager or to have lunch with your judge. And so we set those up inside the courthouse so that that's an opportunity to feel special and to really start looking at what was important for each individual participant in the court and making sure that we offered whatever was working. So you'll notice on this slide that says what has not worked. It's got most of the same rewards on here, the same pictures. You have gift cards, a punch card, a wheel, gift bags, fishbowl, all of those things. And so I left those the same because what doesn't work is not necessarily that this one item doesn't work. It just may not work for that particular court group or that particular individual. What we did find out is that jail doesn't work for us, and that is something at the very beginning of our program we relied heavily on. Now, there are times when we don't have a choice and somebody needs to go into custody. However, we used to rely heavily on that to gain compliance and buy-in to an individual's recovery. What we found is that if we focus on everything else, that's where we're at. We have the opportunity to engage an individual in their own recovery and have them tell us what works, and that has been much more effective and satisfying not only to the client but also to the team as a whole, because the team is wanting to see things work. We also learned that just because an item is appreciated doesn't mean it's what they really value. So we continually reassess and work diligently to individualize our responses and to survey our clients to find out what they would like to have, what works for them, given the resources that we have available to us. some of the barriers that we've faced and that others face are resources. Do we have the time or do we have the money to truly come up with tangible rewards? And I think at some time we've all felt that we didn't have this or that, but when we started making our needs known and we had data that really looked at what we're trying to do, that we have trained all of our team members who then go out into the community to talk to family and friends, civic organizations, churches, etc., to be able to say, this is what we're doing and this is how we're successful, then there always I get a request. What can I do to help? What do you need? And sometimes it's a matter of just having somebody come and help be present in the courtroom to say, I support you. Sometimes it's looking at the opportunity to have employment. Sometimes it's a matter of, well, I have some things I'd like to donate. So we will often get things donated to our program that we're able to then share. From time to time, we've had the opportunity to provide donated passes to sporting events or plays where we focused on that, and that has been very helpful. We looked at, with our team members, is there a prohibited practice? So for our judges, yep, they're not going to go out and ask for donations because it doesn't go with their code of ethics. Are there other things that can be done? And then finally, the barrier that we faced is a lack of ongoing evaluation. So we did our research, we implemented this program, it's great, we know we're doing what we're supposed to be doing, and so we just keep going. Well, what we found is through the help of Shelley and some of her colleagues that, well, what we thought we were doing, we weren't necessarily doing. And so what we've had is the opportunity to say that the data really needs to be there to say that what we're doing is consistent with what we have written as our protocol, that we can ensure that it's fair and consistent, that it meets that 4-to-1 ratio, that we're having the trainings that we need to make sure our teams are up to date on their training, that we also have provided the frequency to deal with either the proximal or distal goals that we're trying to help our clients achieve. As I mentioned at the beginning of my section, we have pretrial release and reentry services here in Mecklenburg County. And with pretrial, they're very limited on how they can implement a contingency management program. They are structured by statute and with just the release. What they were able to share was that their case managers spend a lot of time advocating for individual situations to that individual's attorney. So it shows that they're able to say the client is doing X, Y, and Z, and we believe that they would benefit from X. Then it's up to the individual attorney to advocate for them in court. So none of the actual awarding of any contingency items or rewards is given directly to the client through our pretrial services, but they're able to advocate on the client's behalf with their attorney. For our reentry services, a little bit different. They operate in a phased program, and so as a client is moving through those phases, they offer the opportunity to have less contact or more contact depending on what the client is interested in. They offer the opportunity for vocational training. They offer the opportunity to provide necessary uniforms, work shoes, tools, something along that line, as well as the funds to get the vocational training for those individuals who are working well through the program and have expressed an interest in a certain area. We also offer a housing program for homeless clients, and so we do a stepped-up payment approach to that. So we end up paying for 100% of the housing for up to 2 months, and then we will taper that so that the client ends up having, after approximately 5 months, 100% responsibility for their portion of their housing. And being able to do that has allowed us to offer a variety of praise and rewards in so many different areas. We offer bus passes, and that's a huge plus for a lot of individuals. We also will bring in dinner. We'll have a pizza party or something along that line for some of our groups. And then if necessary, we will offer MRT, moral recognition therapy, for groups in any of the recovery courts or our reentry program. We have been surprised at what has worked, and we've been surprised at what hasn't worked. We have realized that the one-size-fits-all approach doesn't work, and that we really have a need to be able to ensure that we're individualizing our responses regardless of the court that someone is involved in. And so with that, I will turn things back over. Thank you.
All right, thank you so much, Janine. And if we could just move to the next slide. Now we have some time for some question and answer. We've had a number of great questions rolling in throughout the presentations, and just want to remind you, if you look at the right side of your screen, there's a Q&A portal. You can expand that and enter in questions right now, and we will get to those questions. First, I want to revisit, there have been a couple of comments about, all right, I want to apply this specifically to my clients with methamphetamine use disorders. And so I would like to turn it back over to Shelley to revisit some of what she shared during the first part of her presentation in terms of, what's important to consider regarding the drug of choice. So, Shelley, would you like to respond to that comment about, how do we make this specific for people with methamphetamine use disorders?
Sure, yeah. Thanks, Melissa. Basically, so one of the things that we found, not only in research that I've been engaged in, but others, is, there's different strategies you can use with different people based on the problems they're presenting, right? And so we talked about that in terms of specific responsivity. If you have someone who's at a certain level of addiction and needs detoxification services first, you're going to go there first, right? If you need medicated-assisted treatment, you're going to go there first. Then you're going to jump into kind of what we know as more of these best practices that apply across the board, whether it be drug courts or community-based treatment agencies, probation, and parole. And the research has suggested that drug of choice does not predict outcome, meaning methamphetamine users are not more likely to recidivate than opioid users or crack cocaine users. And so drug of choice itself is not really the issue or the driver. Rather, it is trying to figure out what are the criminogenic needs that the individual has and how can we attend to those. But each person is going to be different, and tailoring that treatment plan to where they're at in terms of their addiction is clearly still an important, specific responsivity factor.
Thank you for that. All right, and then we've got a number of questions that get more specific into the needs of people with methamphetamine use disorders. So one person asked, how do brain changes in long-term methamphetamine users, how does the brain changes impact the effectiveness of the reward system programming? The person asking the question is basing that on the assumption that the likelihood of experiencing joy may have changed due to brain changes. So, how do you accommodate for that in trying to implement a reward system? And so, Shelley, if we could start with you, and then Janine, if you could also add your thoughts.
Sure, yeah, absolutely. And so I wish we had one of my colleagues, I think, is actually in this webinar who does research in this area, Jamie Baskey. But this is definitely an area of interest. What we know in terms of, like you said, those brain changes, particularly as it relates to dopamine, there are changes. We also have seen the kind of increase, I guess, back in some of those reward centers after they've been off drugs for a period of time. But I think what we're looking for here is not to replicate the physiological high of a drug, right? We're not looking to replicate that. It's impossible to do so. And so what we're looking for them is what does motivate you. And so that motivation may not be something that is tangible. Like Janine said, those other examples that she gave that bring people joy were not things that we would necessarily think of. And so if you have someone where, and it used to be that they fast cars and fast lifestyle and everything else, but now as they've come off these drugs, as they've detoxed, as they've gone through this treatment process, they find that the recognition from their peers is what makes them feel the best. So it's not seeing it as in competition to. And so even though we've seen those brain centers, like you said, decrease in terms of the experience of joy and so on, it's a matter of still finding out what motivates them. So I'll pass it over to Janine.
Thanks, Shelley. I agree. I think one of the things I didn't mention as probably as well as I should have was that we have definitely found that it really doesn't matter the drug of choice. And what matters most is to ask the individual, what do they consider to be a reward? What do they think will motivate them? And to do that on a planned but regular basis so that it's something that you're constantly checking up on so that you are able to say, well, one methamphetamine user may be different than another as far as what motivates them. The same true for any other substance of choice. It depends on each individual. And so when I say that we were really looking at how to individually respond, that's the crux of what we were getting at, is how do we meet each person where they're at, which 6 months from now may be different than where they are from today as far as what motivates them. And so we have to be ready as a team to address those changes and to move with whatever direction we see that going as quickly as we can.
Thank you for that. And we've had a couple of questions about CBT, MRT. Dr. Richard Rawson gave a popular presentation a couple weeks ago, and during which he said that generic CBT didn't necessarily add to the effectiveness of contingency management. And so one of our participants asked, should we bother with CBT? And Shelley, would you have a response to that?
Yeah, that's a fantastic question. So as we've kind of, the treatment literature, and particularly for correctional populations, has been expanding greatly, which is fantastic. And so in that context, we're trying to figure out, which strategies we should use, which are more effective than others. And there's been a number of studies that have done, like you said, compared, is CBT more effective? Is contingency management? Can you do the combo of the both, and so on? And when you get into those studies, into the kind of nitty-gritty of effect sizes and so on and so forth, you can see, in fact, that contingency management programs can be very powerful. That kind of, apply it and take it away, a process is a very powerful approach. What that study doesn't really, or perspective doesn't really get into that's really important, though, is we are really lacking the dosage of treatment services we need to address all of the criminogenic needs. And so if contingency management is there simply to get people to comply with conditions, right? So you get a reward if you comply, and you don't get a reward, you get a punishment or a consequence if you don't comply. True, that's a very effective approach. But if we move beyond kind of that idea and instead say we need a treatment approach that focuses on all of the core criminogenic needs, your attitudes, your peers, your substance use, your family, getting and maintaining a job, so on and so forth, there's simply no reason to limit to a contingency management program. You need that extra level of service and dosage. And CBT has just shown across the board in a variety of settings and populations to be the more effective option. Okay, I'll pass it to Janine in case she wants to add anything.
Yeah, thank you, Shelley. This is an area that we struggled with because we were not monitoring fidelity to the model for best practice treatment for criminogenic risk factors, criminal justice involved individuals with substance use disorders when we first started our program. And about 10 years ago, we started paying more attention to that and really doing audits on our treatment providers for their fidelity to whatever model they chose that met best practice standards. And we've seen that it does matter if there's fidelity to the model of treatment. And so we've been able to see a huge turnaround in what our clients are receiving, the satisfaction rating of the clients with their level of treatment, as well as with their participation in a drug court. So addressing contingency management through a CBT program and a generic faction may be questionable, but I think when you target the right population, then the CBT programs do have a significant amount of benefit, and the contingency management just goes right hand in hand with that.
Great, and along the same lines, in speaking about these therapies, someone else asked, how successful has moral recognition therapy been in your experience? So would either of you have a comment about MRT as part of a therapy?
Well, I can tell you that our recovery courts or drug courts started using MRT probably 3 or 4 years ago to supplement whatever type of intensive outpatient substance use treatment was being provided. And finding that peer accountability was huge, and the fact that it really looked at criminogenic risk first and substance use second has been the most helpful for probably, this is a guesstimate at this point because I don't have the stats in front of me, but about 40% of our clients have really participated in MRT, embraced it, and actually had spoken to their peers about it, so that we have requests now from some clients who other forms of treatment hadn't worked. They weren't ready to address their substance use, and they really wanted to address the criminal behaviors. And so MRT has been very successful for us.
Thank you for that. Let's see, I'm trying to organize these questions by topic. And we did have a couple of questions coming in about the use of medication treatment. So, with opioid use disorders, we're used to medication treatment. And so we've had a couple of people ask, are there medication treatment options to consider when addressing individuals with methamphetamine use disorders? One participant commented that, he's aware that people are being prescribed dexedrine or Ritalin to address their methamphetamine use. We also know that there are other medications being prescribed. So, just both Shelley and Janine, what are your thoughts on, this approach to using medication-assisted treatment for methamphetamine use disorders, and how might that play into the overall approach to supporting this group in the treatment court setting? Janine, could we start with you?
Sure. First off, I would have to say I'm not a medical professional. So we will use medication-assisted treatment whenever it is prescribed, and as long as it also meets the best practice and licensing standards for that provider. I have not heard of a specific substance like there is for opioid use disorder for methamphetamine, so that I can't really speak to. To me, that if there's something that exists and there is some efficacy behind it, then we would support it here locally. It hasn't been a question that has come up for us, But again, that's where we're really looking at fidelity to a specific model and embracing that for whatever each of our clients need. So I don't know, Shelley, if you have more information specific to methamphetamines, but that's something I don't know a whole lot about, medication specific to that.
Not in terms of the medication, but the drug courts that I worked with, particularly in Idaho, were kind of putting their toe into this area at the time because, you know, for a long period of time, drug courts have really struggled with how to, you know, allow individuals to use this medicated-assisted, you know, treatment in addition to being tested, you know, for drugs, and how does that play into it. I've also been in contact with some medical doctors who do research in this area, and they've even expressed concern that this, you know, the overuse of the MAT approach really is kind of acting as a Band-Aid, that the focus, you know, again, should be that this is the ability to stabilize an individual, and I think the question was something along the lines of, can it help with, you know, adherence to CBT? And I think the answer is yes. You know, if you have someone who you're able to provide them with the medication they need to be able to focus, to concentrate, to engage in the treatment process, and can keep them in, you know, keep them involved in the treatment process versus dropping out, that helps tremendously, right? And so I've seen the National Association kind of start to begin to loosen their standards and allow for that Medicaid-assisted treatment to happen in conjunction with, you know, drug court treatment. So I think the field is generally in agreement, like Janine said, that it's appropriate and certainly can enhance the effects if it helps that individual focus and actually attend treatment services.
Thank you both for those responses. And, you know, this is an area where we are seeing new applications of treatments, and the science is still out in this area. So, you know, here at the Gain Center, we continue to keep a pulse on the medications that are being used, and certainly as the FDA approves medications, how they're being used in the field for substance use disorders. And so we do have a number of questions specific to behavioral management, contingency management. So I want to make sure we get into those. So one participant asked, when we look at targeting behaviors, how many behaviors should you target at one time? And what do you do with the other negative behaviors that are happening at the same time? So I'll let you both respond to that. If we could start with Janine.
Well, I can tell you that in our courts, we look at proximal and distal goals. And so we choose a proximal goal, something that is going to be able to be achieved in a shorter period of time. And we focus on the behaviors that help achieve that goal. We look at not only having a proximal goal, but breaking that down even further and saying, we have 2 weeks between court sessions, so what's the goal for the next 2 weeks? And then the behaviors that are related to that goal are what we're focused on for the next 2 weeks. And at the next court session, we update, we talk with the client, we talk with the judge, we talk with the attorneys, the probation officer, the case management team, and the treatment team, and we target, does that positively or negatively impact that goal? And the concept of positive reinforcement's been difficult for criminal justice to embrace. The tendency to want to address everything that didn't happen versus the positive things that did happen is more traditional criminal justice. And so I spend a lot of time educating my teams on the need to just ignore certain things, that if it's not a risk to public safety or risk to the individual, then we're just going to focus on this for the next 2 weeks. And slowly but surely, they're coming around and they're seeing that not everything needs to be addressed by the court. A lot of it can be addressed by treatment, can be addressed in a one-on-one appointment with their case manager or through their community recovery support system. And so that's where we are in addressing that. I don't know, Shelley, if you want to take it from there.
Yeah, thanks, Jean. I think there's kind of two ways, or there's multiple ways you can look at it. One is, like you said, developing goals. I love that. So the idea is that we're focused our kind of resources on, this is the goal, this is what our expectation is for you the next couple of weeks. So that's that one approach that's individual with the client. If I think back to you're developing your program manual and kind of thinking about, all of the different target behaviors, it truly can be not endless, but there are a variety of ones. If I took an example like group functioning, and you want people to attend group, you want them to be there on time, you want them to do their homework, and you want them to participate. That's 4 target behaviors really related to group functioning. So, it's really, there are a variety of ones you can do and then hold them accountable for that. So your target behaviors can be kind of geared around kind of the rules or expectations for anything down to the level of group all the way up to the goals that you might have for treatment. And there's no reason why you couldn't address negative behaviors that didn't fit within that scheme, right? You won't be able to develop a manual to account for all the behaviors that might occur, negative or positive. And so certainly having a system that's flexible, but also people kind of understanding the theory behind it, that we're trying to shape behavior through rewards and consequences. And so having kind of a good understanding of why we're doing this and the theory behind it will allow them to kind of be flexible and respond to people both negative and positive, regardless of the behavior.
Thank you for that. And one last question before we move into some of our closing slides. And I do want to let people know, if you submitted a question and we weren't able to get to it, then we will be pulling together responses to all of your questions that haven't been answered yet, and we'll share those responses with the slides or the webinar recording once those are ready. So the last question I wanted to visit was around jail sanctions. So we've a number of times today talked about how jail shouldn't be the automatic response to someone who may have not complied with an expectation. So what behaviors, if any, do warrant a jail sanction, and how do you determine how long the jail sanction should be? Shelley, would you like to start us on that one?
Actually, if you don't mind, I'll throw it to Janine, since I know this is something they deal with already, just to kind of talk about for them.
Sure.
So we started back 25 years ago, and we had a grid, and it said if you did this, it was an automatic 24 hours in custody. And if you did this, it was 48 hours, and it went up to the point of 45 days. What we have learned in the last probably 10 years is that we weren't seeing a turnaround in behaviors based on increasing jail sanctions. We were able to see that by backing off the use of jail sanctions, we have been able to affect a more personal involvement in my own recovery, because now you care about me as a person. It's not just about sending me to jail. So for some people, going to jail was actually a reward. I have small children at home, and my husband's driving me crazy. So yeah, I'll just, 3 hots and a cot, I'm good. Let me just go to jail for the weekend, and I know I'm getting out in 48 hours, so it's really not that big a deal. So that didn't seem to be beneficial or a wise use of the funds that we have for putting folks in custody. As far as what constitutes jail, really it's public safety issues. So if we have somebody who is deemed by their probation officer or the team as truly being at risk to themselves or the community, then we're going to put them in custody. We have had clients who said, the judge, and this would be during their exit interview, the judge kept telling me that if I didn't stop doing this, I was going to go to jail. And I didn't believe her until she put me in jail. So the best sanction, best reward I ever got was the judge putting me in jail. And that's not unique to us. You hear that throughout drug courts across the country. But the point is, there isn't really oh, if you do this, you're going to jail. Now, in our area, we have a unique opportunity of having a substance use treatment pod within our jail. So sometimes people will opt to go ahead and do an inpatient jail substance use treatment, and that's pretty much the only one that we use frequently. And that is, if somebody is not able to do inpatient treatment in the community because they won't stay, then they will opt with their attorney to go ahead and do that substance use inpatient treatment inside our jail. So I don't know if that answers the complete question, but maybe Shelley, if you have more to add.
No, that was great. Thanks, Janine.
All right, thank you so much. And so we're at the end of the time for questions. You have seen a poll pop up and a couple of questions about further technical assistance around this topic. So we would love your input there. We also have a file transfer popping up on your computer. Don't worry, that is our system sending you that file. And this will allow you to download the webinar attendance certificate, which again is for your personal use. And how you download that is to click on the webinar attendance, the file name there. That file should turn blue, and the download button should turn a darker gray. Then you can click the download button, and it will save the certificate directly to your computer. We would love for you to join our next webinar, where we'll be focusing on navigating various system cultures across the sequential intercept model. That webinar is coming up on June 26th at 2:30 p.m. Eastern Time. And if you haven't signed up for the Gain Center's listserv, here is a link. Just enter this link into your browser, and it will take you to a form where you can enter your information in and receive our newsletters. So we provide a monthly e-newsletter that features various programs across the criminal justice system, addressing the needs of people with behavioral health disorders, and we send that out on a monthly basis. We also will use that listserv to let you know about upcoming events by us and our partners. And finally, if you have any questions, here is contact information for SAMHSA, as well as for us here at the Gain Center. And if you have any questions or just would like some phone-based technical assistance, please reach out to us. We do have some small amounts of funds to provide phone-based technical assistance to communities across the country who would like additional assistance serving people with mental or substance use disorders in their justice system. So we welcome you to reach out to us as needed. Thank you so much to Dr. Johnson and Ms. Gonzalez for your presentations today. We really appreciate the information and the expertise that you've shared with us. So thank you so much, and we look forward to having you all join us for our next webinar in June. Have a great afternoon.